Good morning, everyone. So again, a big welcome to our esteemed panelists. It's a pleasure and privilege to be here with you on the stage. You've done phenomenal work over the years on transforming healthcare, not only in UAE, also the region. So my name is Sumit Puri, and I'm basically going to be, moderating this panel. And just to mention clearly about cloud adoption, it really is the flavor of the day. But now the question is not about if, it's about when people will adopt the cloud. So so many companies across the world and countries have basically embraced it. And today we'll try to highlight how to best leverage cloud to empower operations, data management, and also enhancing patient safety while optimizing costs and resource utilization. So to me, without further ado, let me start with you, Sadia. What's your first great definition of hospital in the cloud? And could you please elaborate on what big changes the adoption of cloud is bringing to healthcare for doctors, patients, and also hospitals? Thank you.
It is. All right. Good morning, everyone. Thank you, Sumit, for a very interesting question, something which is very close to my heart. So, a hospital in the cloud at its very core is disaggregation of administrative and clinical services that are typically provided in a hospital, virtualizing them, and then re-aggregating them to serve the patient's needs in a hyper-localized, hyper-personalized context, which also takes into account the context of their lifestyle. So imagine a healthcare system where the building blocks, basic building blocks of services are virtualized and available in the cloud on demand. These basic building blocks could be revenue management, IT, analytics, sensor-based technologies, remote diagnostics, and patient EHRs. So anything and everything which is causing friction and distracting the practitioners from their core responsibilities and their core competencies in the future should be and will be abstracted away and available as services which can be pulled upon to offer customized solutions to the patients. So this kind of a modular and unbundled approach is very important, is pivotal to the orchestration of customer journeys or patient journeys as we move forward. In terms of what this means for all the players involved, let's talk about the healthcare systems first. So I think it's a win-win-win for all the stakeholders. For the healthcare systems, it basically is the best model that will enable smarter resource allocation. It will lead to better cost structures. It will lead to more efficiencies, getting rid of wastage. For the doctors, it will free them from things that are best left to non-clinical experts. And for the patients, it will translate into timely, precise, and convenient solutions. So today, no matter how great a hospital system or a healthcare system is, you cannot take it home, right? But a hospital in the cloud will be agnostic to geography and time. So that's my definition of hospital in the cloud.
Awesome. Thank you so much, Sadia. I mean, taking hospitals home, that's amazing. I must say it's obviously going to be win-win for patients, for doctors, and for hospitals. And to me, the fact about personalization at scale, that's something definitely cloud offers. Thank you so much for the inputs. Ashish, how's data computing and other emerging technologies playing a very, very critical role in revolutionizing the ecosystem for healthcare? And, is it also helping to further accelerate, the innovation within the healthcare industry? Your thoughts, please.
Yeah, first of all, good morning to everyone here, and congratulations to Forbes Middle East and PureHealth for arranging this wonderful event. Going back to your question, we've seen, and especially as a company as G42 Healthcare, which was sort of at the cusp, or just at the time before the pandemic started, and we've seen this huge push for digital transformation post-pandemic, and digital transformation is going to unlock the value of medical data right now. Now, going back to what benefits does cloud bring into the healthcare ecosystem, I believe we are working on, just following up on what Sadia said, the modular concept, cloud-based composable digital architecture, where we can decouple data, applications, governance, security, and you have multiple companies. I actually met one of the companies while entering here that works in a particular sector within that decoupled area, and you can benefit out of a lot of applications across the healthcare ecosystem. With the digital transformation, you would see a lot of data being pushed on the cloud. I read a report by Gartner that 60% of medical data is going to be on the cloud by 2026. But you have to look at certain factors that are key enablers to ensure healthcare facilities, researchers make good access of it. One is interoperable type of data like FHIR or smart apps that can allow physicians to access patients' data to make it more personalized. You have the right mechanisms where you can take these data and put it on a cloud, de-identified, allow for governments to take the right decisions at the right time. We've played our part. We have a platform called Malafi, which is the Health Information Exchange, and it's on the cloud. It was on the cloud at the right time for the government, especially the Department of Health, to take the right decisions on pandemic disease management. So here is a perfect example of population health management using data on the cloud in the right way. And I think also, as people tell me to grow out of the startup mentality, but I'm always going to think like that. As a small AI startup that started 3 years ago, we needed data to build models. And I think the fact that we can put data in an accessible manner, de-identified with the right security protocols, for researchers to tap into and build models around one problem that can be used by healthcare facilities to slowly change the world. I think that it's the factors of all these things together that will potentially allow these cloud computing solutions to drive into precision medicine. And talking about precision medicine, it cannot be pushed across without unlocking data. Data is key here. So we are working with this program with the Department of Health called the Emirati Genome Program. That's a program that it's completely deployed on the cloud, and hopefully soon it should be, the access to that should be open to different universities in the country, and this is all leveraged using cloud computing methodologies.
No, that's awesome, and I must congratulate. I mean, the world has been looking up to the way UAE has managed COVID, the way we basically put together the ecosystem, and of course there's data. Data is the new currency, and I think companies like G42, PureHealth have played a very, very key role in doing this. And you mentioned about data applications, governance and security coming together. And 60% of healthcare data to be on the cloud by 2026. That's incredible. I think clearly speaking, the movement is towards that, and I think there's going to be huge traction. And with the help of that level of visionary thinking, I'm sure there's a lot that could happen. Sadia, coming back to you. If you look at the integration of cloud, we know there are multiple clouds around presently. How do you see that paving the way towards collaboration and also interoperability? Because that's something we're obviously working on, to have healthcare information exchange, providing better and effective healthcare delivery for the patients. Just elaborate on that.
Sure. So Ashish just touched upon, the kind of data that now exists in the healthcare space. And yesterday also, the experts shared, their observations and how they have seen the healthcare data just, grow at an exponential speed. I would say that today, the healthcare data is not limited to EHRs and EMRs anymore, right? We all know by now that EHRs and EMRs do not capture a lot of contextual data. They do not capture the other factors which play a big role in being determinants of health, right? Be it your environment, be it your lifestyle, be it your, the data that we can glean from your social media feeds, your behavioral tracking, your wearables, right? The data which really is important from a healthcare perspective now spans, the entire spectrum from being very, very structured, the EMRs, the EHRs, to extremely unstructured. where you live, what kind of air quality you breathe in,
Absolutely.
and what kind of social groups you are a part of, right? Cloud computing has kind of allowed for these disparate data streams to come to bear on the inputs that are driving prescriptions and that are driving personalized treatment for the patients, right? So this kind of integration, this kind of amalgamation, or this kind of personalized understanding of person's health was not available in a data center kind of an environment, right? Similarly, from the point of view of providers, they need to have the flexibility to move data seamlessly across different environments. In today's day and age, the healthcare provider teams, they sometimes work across departments, they work across institutions, they sometimes work across different countries, and they all need to access data which is residing in different environments, and this can only happen with a cloud-based infrastructure. So healthcare to me is a very, very complex problem which continues to evolve every day. The population is changing, the diseases are changing, the research is, pointing us in new directions every day. The generational attitudes are changing, the expectations are changing, right? Social, economic contexts are changing, the global contexts are changing. For this kind of a complex and ever-evolving problem, you cannot depend on fixed infrastructures. You have to have an agile and flexible infrastructure which is progressively adapting to suit, or to be able to solve the problem at hand.
Absolutely. Well, thank you so much. And I must say this, in fact, somebody asked this, there's a very interesting joke that went around saying, which was the factor that accelerated digital transformation in your company? It was basically COVID. It was not so much, the CEOs or the CIOs. I remember in Max Hospital when we used to basically chase doctors for telemedicine. We had such a struggle to getting them to embrace. Now they were chasing after us, after a point. So there's huge transformation. And as you rightly said, it is about no longer contextual, it has to be much more contextual. It can't be siloed EHRs and EMRs. You have to make it much more, useful and relevant for the customer, across, and merge these silos, and cloud can play a big role around that. Coming to yourself, Ashish, could you tell us, in order to make healthcare costs more sustainable, we know there's a lot of costs that actually are spent by governments and also, insurance companies. The focus of several governments and insurances now globally trying to bring prevention forward and looking at more preventive care rather than curative treatments only. Could you tell us how the sector is leveraging capability of the cloud, provide personalized, holistic, and preventive care?
Sure. So healthcare adoption is critical. We all agree that, and I think that's one of the reasons why I have this panel. But I think the approach by each provider should be taken based on a pragmatic, focused basis where it is a balance between feasibility and value. You just cannot put every data set on the cloud and then expect magic to happen. But there are key cases. Let's just take, Sadia has mentioned, beyond EMR. You can put EMR, PACS, ERP, all on the cloud. And just with those simple data sets, you can run a lot of applications let's take it from a patient perspective. You can set up an automated appointment booking system. From a physician perspective, with the fact that right now Google Cloud allows patient data or Fitbit to be pushed across to the physicians with consent, you have an area of getting a personalized risk score based on your EMR, HIE data. And just take about from a cost operational efficiency perspective, the finance department would love building models of your claims data sets across on the cloud. So there's a lot, but I think each provider should take the right decision based on what is their value add and how do you reduce your expenditure. Yes, you're right, the pandemic boosted digital transformation, but it also reduced a lot of budgets for entities because it was on turbocharge during pandemic. So how do we find that sweet spot? I think that is the challenge. Now for us, we have the health information exchange, which is now pulling in imaging also. So you have phenotypical data, imaging, genomics, all together in one central data platform. And I think providers, governments should move ahead from looking at systems as silos, but look at it from a platform perspective on the cloud. And I think that should drive the way to preventive and precision medicine.
Absolutely, wonderful. I think clearly platforms are the key. The ecosystem, building that I think is going to be extremely useful as we go forward. And already great thinking already happening around that. So thank you so much for the response, Ashish. Sadia, what do you think are some of the challenges associated with incorporating cloud technology into operations and practices within the healthcare sector? We know doctors are being doctors, it takes time. So what do you think would be the challenges?
Okay, to me, it's not really, the doctors or the technology that is the obstacle or the challenge. I think technology has the capacity to solve this problem. The obstacles are more in the form of, these tightly integrated, tightly vertically integrated systems and healthcare providers who just do not want to leave the business model that has worked for them so far, right? So a classic case of, legacy success, not giving in to disruption. So that to me is the biggest barrier. But in today's day and age where these, decentralized autonomous organizations or DAOs as they are being called, they are kind of making their way in all industries and they will come to the healthcare very soon. So that is the kind of environment and that is the kind of world that we should be preparing for and solving for. Other than, this legacy mindset problem, I think the regulatory framework as well as the financial frameworks have to be flexible enough and accepting enough to change with this, more agile, unbundled, modular world. So today, nobody wants to experiment anything which will not ensure a financial reimbursement, right? How do you work around that problem or how do you solve for that problem? So I would say the problems or obstacles are more related to the market design and the market structure than technology or even, doctors, because I'm sure doctors would really welcome getting rid of or not having to do the things that does not inspire them, right? So the clinical administrative work and things that detract them from their core responsibilities.
Absolutely. No, thank you so much. I think frankly, business, technology, operations, clinicians, all need to come together with clinicians at patient safety at the center. In some ways, outcomes to be the key focus. You're absolutely right. It's not about one particular section. It is about everybody holistically joining hands for the outcome achievement as such. Ashish, just to talk about the increased adoption of cloud technology. Of course, we've seen that this region is still somewhat behind some of the other countries, especially Europe, US, on that. What do you think, with the genomics project and other key projects you are already doing, how will increased cloud adoption, impact the future of medical research and science in general? What are the potential benefits of having access to vast amounts of health-related data all stored in one place, which I think you guys are probably the best person to answer that because there's so much that could be done with that.
That's a very interesting question, and I might challenge it a bit also. I mean, absolutely. I mean, we have to leverage this large, as Sadia also said, diverse data sets to generate value out of it. But not necessary. It does not need to be in one place. Just because one entity is generating a lot of data sets, it's great, but it's not going to change the world. But you have to work on a mechanism that you can work with data sets across geographical borders. We have something called federated learning, which supports that. So if we have in the borders of the UAE data sets which are following GDPR right in the right place in a centralized way, and we can work with other countries using the same mechanism, we can build a federated learning models to work across those data sets and then apply it to predictive and precision medicine. So I think that is one challenge that UAE and the countries in this region need to adopt. I believe certain countries in EU are bridging those barriers. One of our successes also has been through building partnerships. You want to build the right partnerships, you have to offer the right data sets to the right partners. And this is a brilliant way of allowing partnerships and innovation by opening these data sets in the right way, by de-identifying them in the right secure way with the right protocols and provide it to the world's best researchers to come into Abu Dhabi and drive research. So it does not need to be in one place. and does not need to be centrally aggregated, but I think you can work off federated learning across those
Thanks
data
so much
sets.
for correcting me. And frankly, and that's a very refreshing thinking. Frankly, that's what is needed.
Yeah.
Much more open standards, much more
Correct.
ability to basically integrate data across. Absolutely. Given that there's still some reservations, Sadia, I'll just come back to you quickly. In the minds of some people around security of data on the cloud, what could be the steps and recommendations from your side, which you think could help us in enhancing cloud adoption in this region and beyond?
I'm not a technology expert, but I do know that, the security posture and the security protocols that these major cloud providers come with are at par, if not better, than, the enterprise data centers. Plus, within the cloud architecture, you have a hybrid, multi-layered cloud infrastructures which are available. You can afford, if you can afford, you can, have your private cloud for more security-focused data and workloads. And for more routine activities, you can always use the public clouds, right? So there are ways of ensuring data security and actually strengthening data security in the cloud infrastructure for sure. They are very, very robustly built. You do not have any issues with respect to, redundancies and backups. So I am a big believer that, we should leave the expert's job to the experts, right? So you cannot compete with AWS and Microsoft Azure and Google Cloud and come up with a homegrown system which kind of keeps you or makes you ready to operate in the world of the future.
Absolutely. Thank you. Coming back to you, Ashish, what do you think would be the best ways forward?
I think a couple of factors. Return of investment. If I was looking at as an enterprise, cloud providers, G42 has a cloud. We have our own G42 cloud, and I keep telling the CEO, his name is Talal, I tell him the same thing. Come with a good return of investment plan that you can talk to hospital operators. Second, a pay-as-you-go. There is a pay-as-you-go scheme where providers jump onto it saying this makes sense because I just need to pay as I use, but your costs are going to go up. So if you can bridge the gap between a good ROI versus a pay-as-you-go predictive costing exercise and build that awareness, I think that's what I think Sadia also touched about, build that awareness to talk to physicians, to doctors and the decision makers. Just because data resides on the cloud, it's not just going to be magically accessed by everyone on the planet. We have to build that trust component. And also for the benefit for cloud providers, if there are any, I think this is the perfect time, let's call it, the usability factor for IT systems across the globe after pandemic is at the all-time low. People are not appreciative of IT systems because they wanted to do more. This is the perfect time for cloud to come in and pitch their solutions and allow for greater adoption.
Absolutely. I think very well said. And I must say, geography has become history very clearly. And I think, as you mentioned, leave it to the experts. I think that is the key. I mean, the Amazons and the Googles and the G42s, and of course Azure, all of them have done excellent work in terms of putting those standards in place. And these are being used across the world. Europe, US, everybody's already done it. So there's no need to reinvent the wheel in some sense. So thank you, Ashish, and thank you, Sadia, for that. I think we probably will just request for, if we have time for a quick question and answer session, we maybe just start with that and then maybe. Sure.
Hi, thank you for having this session today. My name is Harasal and I'm the CEO and founder of Shawarna. We're a startup working in health tech, especially virtual reality, and Web3 and NFTs and fintech. So when you're talking about the cloud, you also have options for blockchain, and that's the new technology. There are state proofs where you can secure your data. A new form of cryptography is present. So may I know, have you actually integrated that into your clouds? Are you sticking to the old systems? And are you when it comes to the blockchain, everything is open. You can see it. But you can also have and reserve your security mechanisms there. And it's international. So how far has this been implemented into the healthcare system and also the virtual reality sense or the Web3 sense and that kind of data collected and aggregated and integrated into your systems? Thank you.
I'll just break that question really quickly. The blockchain part, we have already applied blockchain in a consent management platform across for the Emirati Genome Program. So if any volunteer participates into this program, it's stored in blockchain and he can revoke that consent at any time at which the sample will also get destroyed. So we have already applied that. And I think it's a much needed application that needs to be applied. However, for virtual reality, I don't think so. I think it'll take some time. I think we are taking baby steps. At least that's my perspective. I don't know if Sadia has a different perspective. It'll take time is what I say, because you need the data sets in the right way, stored in the right way, to allow data to be leveraged in the right way. So one step at a time, and hopefully soon in the next meeting, we should hear more on that in the healthcare space.
Thank you so much, Ashish. I think, again, I'd probably end this session with thanking both the panelists. Absolutely enlightening session. And, again, thank you to the audience. Thanks so much. We'll end here. Thank you.
Thank you.